Good episode that we got to banter a little bit about 3 myths that we kind of say, like, are they real or are they not?
I get these questions all the time, especially blue balls, especially post-nut clarity, and really a lot jelqing. I think it's time we finally set the record straight with these.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week, our episode is titled Talking Blue Balls, Post-Nut Clarity, and Jelqing. Are they real? Justin, this was a good episode that we got to banter a little bit about 3 myths that, that we kind of say, like, are they real or are they not?
Yeah, they may not be myths. They may be real. And I think we get a good mix of what's real and what's not real. I think some are potentially more harmful than others. And so I think this was a really fun episode because I don't know about you. I get these questions all the time, especially blue balls, especially post-nut clarity, and really a lot jelqing. So, I think it's time we finally set the record straight with these.
I thought for a minute you were about to say I experienced all 3 of those in the past few days.
At the same time. Well, actually, we know you can't have post-nut clarity with blue balls because you're never coming. So,
that's right. That's right.
Well, maybe you can jelq your way into blue ball.
But yeah, no, it's a really good episode because we not only just talk about it, but we kind of break in some science, the physiology of, what's happening during blue balls, the physiology of what we think is happening during post-nut clarity, and just plain simple jelqing and why you shouldn't do it.
Yeah.
That's all I got to give.
Yeah, I mean, it's true. So, but I think that what's cool about a lot of this stuff is, like you said, there is some data or at least physiology behind why we think things may happen the way they do. And I think a lot of people are going to be surprised by what we tell them and what they tell them is real, what's not real, and what may be real. But yeah, we could talk about this shit forever. So I think we should just get into the episode. What do you think?
Yeah, let's not leave them up to suspense.
Let's not give them blue balls and get to the episode so that they can have some post-nut clarity. There we go.
Oh, so beautiful.
All right, guys. Thanks for listening. As always, subscribe, download, follow us on at the Man Up Pod on all social media platforms, and we'll see you guys soon.
All right, Justin. So the first sex myth that we're going to talk about right now is the infamous blue balls. So we're going to discuss what are blue balls and if they are real. So Justin, let's start it off. I'm just going to ask you that question. What are blue balls and are they real?
So despite relatively little research on the topic of blue balls, and despite what a lot of people believe,
it feels like everyone knows so much about it, but yet when you look at the evidence, or literature, it's real.
So blue balls are real, believe it or not. And I think that's surprising to a lot of people. But we also call it epididymal hypertension, which is, I guess, the medical term. But there's relatively limited data.
Less sexy.
But blue balls is definitely real. And now, Kevin, what really causes it? Why is it called epididymal hypertension here?
So when you're getting aroused, right, we are increasing blood flow into the genital area, right?
Right.
Let's just talk simply about erections. When you're getting aroused, the whole idea of getting a good erection is to get great blood flow in. Well, that's happening everywhere in the genital area. It's happening in the muscle area. It's also happening in your testicles as well. Right behind the testicle, there's something called the epididymis. So everything there is increasing the blood flow, which causes an increase in that localized blood pressure, right? And so that is that pressure, everything's kind of happening there. And the whole idea of blue balls is actually that at the end of, when you ejaculate or when you orgasm, that you're supposed to have release of all this pressure of blood flow and it's supposed to cease and go out. And when you lack that last part, you kind of have all this pressure built up.
Right. So it's this idea that, prolonged sexual activity without achieving an orgasm, or you're just losing that desire, that blood flow while leaving your penis at a slower rate, but your penis is a bigger organ, obviously, so it's
Right.
draining and not as painful, even though
Right.
you're probably sad that you didn't come. In the testicle, that blood really gets trapped, and that increased pressure, that persistent swelling or congestion, is really what blue balls is. Obviously, though, it's funny because your balls don't literally turn blue.
They don't?
Yeah, I mean, honestly, the funny thing is, right? Maybe they do. Who knows? They're inside your scrotum. We can't see your balls. It's not anything we would ever be able to really tell you. But I do think it is interesting, the term blue balls there.
Yeah. You know what? I think you present a really interesting, science experiment that we should do one day. I don't know how we would do it, but I would actually want to know, do your nuts turn blue on the inside and you can't tell?
I would think they would turn red, if anything, right?
Right. So much blood
Because
flow, right?
right, all the red blood flow, it's arterial blood. It's like oxygenated blood. So I would say probably the proper term is red balls here, but it just doesn't have that what's the alliteration of blue balls, right? It's not as poetic.
Now, you know, let's talk about why blue balls is talked about so often.
Right.
And it's because guys, we get it's rather unpleasant, I guess you could kind of describe it, feeling, right? This sensation of a bit of discomfort down there, a little bit of heaviness, a little bit of achiness, kind of like it kind of feels incomplete. That's kind of the way I
It's
describe
literally incomplete.
it.
Incomplete.
Incomplete. Yeah. Literally.
But yeah, I think that so if your partner is listening to this, I would say most dudes have experienced blue balls at some point, so they can relate. But yeah, there is this discomfort and heaviness by that swelling and congestion of the blood flow in your testicles. But it really shouldn't last too long, right? There is some data. There was an interesting case study I remember reading where like a peds patient, like he was like 16, 17 years old, had like presented to the ER with blue balls, and they did an ultrasound. Everything was fine. And you find out he was just masturbating for a long period of time and never orgasmed. But I think that it usually resolves, less than an hour. It's not that long. But, is it dangerous, Kevin? So is blue balls actually dangerous? Can this be harmful to your body? Because I think that that's one thing women always hear, right? You have these guys going, hey man, hey, I got blue balls now. I think you got to finish the job. Like I'm going to die. So is blue balls dangerous, Kevin?
So the truth of the matter is, no, it's not. So that as the partner, you should not feel compelled that you have to fix the blue ball problem, which, fixing blue balls is, generally there's a couple things you can do, but most commonly you can just relieve yourself with either masturbation or some sort of sexual act. But your partner does not need to feel compelled to do this because it is dangerous. There's no evidence for that. Even though I must say, now that I think about it, epididymal hypertension, we're all saying like, oh, hypertension, that's bad for you. It's bad for your heart. Not in this not in this situation. This situation, quite the opposite, actually. You don't need to relieve it. It'll be fine.
Yeah, I mean it's an incredible, interesting take. If you want to go the other way, there, we need to treat the hypertension and then alleviate it. But yeah, it's definitely safe. I agree with you 100%. You should not feel obligated to alleviate someone else's blue balls. As unfortunate as a lot of guys listening this may hear. But there are other ways, right? Obviously, like you said, ejaculating can help. father time, just taking it easy. Some people like to take a shower and just decrease the stimulation, but time will eventually heal all in this situation, and it's not going to um, be a real issue. So, I mean, is there any other things we're missing about blue balls? I feel like we've covered a lot about it. I mean, anything we're missing, Kev?
No, I don't think so. I mean, at the end of the day, blue balls, this is a real phenomenon. You're getting a lot of blood flow down there. You're really not getting it released, but it's not damaging to you. It's not harmful to you. It tend to should go away on its own. There's things that you can do to kind of help you relieve that. And most importantly, as a partner listening, you don't have to feel compelled to relieve this pressure.
But if you want to, you're more than welcome to, I'm sure.
Absolutely.
All right, that is one myth that is actually real, right? So that one was debunked.
Yes.
That's debunked to be true. What's the word there?
That's not a myth, but
not a myth. That's
not a myth. There we go.
It's a fact.
It's fact.
All right, let's move on to the next one. All right, so the next sex myth we're going to talk about today is the infamous post-nut clarity. This idea that after we come, we see the world better. We feel things better. Everything comes crystal clear, not to be punny. So the question is, Kevin, is post-nut clarity real?
Well, I think most of us guys, if we're talking locker room talk, we'll say like, hey, we've experienced it, right? That, we're like, yeah, this must be a real thing. But interestingly enough, there is actually no real data that confirms that post-nut clarity is an actual phenomenon. All right. As all things science, we want to have good data, good evidence for everything. And in this particular area, there just really isn't any definitive proof that it's real. But remember, in a lot of talks that we always talk about with other things, just because there's not proof doesn't necessarily have to say that it's not a real thing, right? So I think to really understand why this could happen, potentially, you kind of have to really get into the physiology of like what's going on during an orgasm and what happens afterwards. So Justin, why don't you kind of break that down for us?
Yeah, so I agree, Kev. So while there is no data showing that post-nut clarity is real, there's obviously no data showing that it isn't. And I think that there is a consensus here that we've almost all experienced this sensation in the past. So describing post-nut clarity, we really have to understand orgasm and the physiology behind orgasm. So, orgasms are separate from your erections, are separate from ejaculation. They're obviously associated with ejaculating, but you can ejaculate without orgasm. You can orgasm without ejaculating. But when you do orgasm, it's associated with things like pelvic muscle contractions, the contraction of your bulbospongiosus inside around your urethra. That's usually associated during ejaculation. It's also associated with the release of hormones like oxytocin and prolactin, and hyperventilation and facial grimacing, which we often call vinegar strokes, if you know what we're talking about. So, orgasm, quite simply, is the body and a brain thing, where ejaculation is really the release of fluid from your body. So now that we understand that, we can really try to break down the idea of the orgasm and why post-nut clarity, although no data shows it exists, very potentially does exist. So the first thing that's really cool is that we do have data showing that with ejaculation and orgasm, there is decreased activity of men's prefrontal cortexes of the brain. Now, the prefrontal cortex is really responsible for regulating our thoughts, our actions, and our emotions. So, when we orgasm, that area shuts down, right? I mean, it's pretty
You've
crazy,
just
right?
gone full tunnel vision. Yeah, everything
Right.
else is completely blanked out.
But that's important, right? We're not thinking about anything. We're tunnel vision. We're focusing on pleasure in that moment. We look into each other's eyes if you can, and you see each other's vinegar strokes, and then you see into each other's souls. Um, but I think what's important is when that leaves and your orgasm has ended, you have return of blood flow to your prefrontal cortex. So it is a return of your thoughts, a return of your emotions, a return of potentially thinking about doing some actions. So this post nut clarity is really a rebooting of your brain that shut off temporarily during your orgasm. So that's one. Two, the hormones that we discussed can potentially play a role. Now, we mentioned that orgasm is associated with the release of hormones like oxytocin and prolactin. Now, oxytocin causes a feeling of sexual satisfaction, emotional intimacy between partners, and it's also an anti-anxiolytic, so it can calm you down, reduce stress um, after sexual activity. So once again, after you orgasm and this is released, it can help provide that sense of calmness and relaxation. Finally, you have the hormone of prolactin. Now, prolactin is something that Kevin and I actually work up a lot for
Mhm.
ejaculatory dysfunctions, for orgasm dysfunctions, for low testosterone, because of its interesting role. While it is not a sex hormone, it is released after sex, after orgasming, and it actually plays an interesting role in refractory period in men. Now, Kevin, what is refractory period?
Well, refractory period just means, hey, in that interval, you're just not really able to get another erection going before you're able to kind of get right back to it, as you say.
Yeah. Now, just for our listeners, refractory period is different from erectile dysfunction, right?
Oh, 100%. Erectile dysfunction is when you're just not able to get blood flow. It's not related to, having a recent erection or any of that sort. Refractory period is very, very separate. Now, on that note, Justin, I'm just kind of thinking off the top of my head, and I
Yeah,
just want to kind of talk this out because I find this interesting. So, prolactin, when it's increased, causes low testosterone, right?
correct.
And so now in this refractory time period, you kind of have a low testo. Is it actually a low testosterone state or not? I don't know.
I think it is. So I think it's a low testosterone state. And I think that that creates that refractory period
Hmm.
that people have and that lack of desire to engage in sex right away for people.
Yes.
And I think it gives them that sensation of calmness, and that they're like, oh shit, I'm tired. I just orgasmed. Let me just chill out. So I do think that spike in prolactin decreases
Hmm.
that testosterone, which prevents you from going right into it right away and impacts your refractory time. Now, one thing about refractory time, once again, is that that is not erectile dysfunction. That is something that's very hard to treat. Now, as we get older, refractory time can typically get longer. And
Unfortunately.
yeah, unfortunately. And I know that I've seen guys who come in and they think they have erectile dysfunction. But when I ask them what they have and they go, Doc, I just can't have sex 4 times a night anymore. And I'm like, shit, dude, most people can't. But congratulations, you did. And sometimes as you get older, you just can't recover as well.
But you're important point that you make. It's very separate from erectile dysfunction because a lot of guys do come and say like, "Hey, doc, I'm not having sex like the way I was when I was 20 years old." Right?
Yeah.
And to your point, that's very important because it's a difference if it's like I can't even get an erection like I did when I was 20 years old versus yeah, the frequency has kind of gone down. I can't get right back into it, 5-10 minutes after like I used to. Again, very separate issues going on. And unfortunately, it's just a part of aging in terms of from the refractory aspect that is difficult to treat.
Yeah. And then, so prolactin, and then finally there is one other aspect, is your parasympathetic nerves. Now, the parasympathetic nerves are the rest and digest part of your nervous system, right? You have the fight or flight, which is the sympathetics, and you have the parasympathetics, which is the rest and digest. So these play a role in orgasm. So they're activated at that time. So, you feel rested, you're relaxed, often because of these parasympathetics. So when you put all of these things together, the shutting and off and rebooting of your brain, of the prefrontal cortex, the hormones, the oxytocin, the prolactin, the parasympathetics, it kind of makes sense that post nut clarity exists. I'm a believer in post nut clarity. Kev, what do you think?
I mean, I like to think so, because that's the way I kind of feel, that there is times when you have clarity after you nut. And yeah, I think, yeah, you're absolutely correct. If we really break down the physiological aspect of it, yeah, quite simply, yeah, you were tunnel vision. When you think, your tunnel vision, aside from the hormones, your tunnel vision, and all of a sudden it's like someone just took away, opened up the blinds again. Of course, everything's going to seem a lot more clear. You got more light coming in. It's going to seem more clear. So yeah, I am an avid believer.
We're both post nut clarity guys, pretty much.
Yeah.
PNC guys. So I think one aspect of post nut clarity that I wanted to ask you is that there is this other aspect of it, right? Is post nut clarity always pleasure or calmness? Because I think we've all been in a situation where, even though we've orgasmed, we do have some regret. So is there, can you have shame or, issues or concerns, or feel differently, feel things other than pleasure after you orgasm?
I think that's an excellent point, Justin. And I think it all really falls under the same umbrella. And it's kind of something that's been referred to as postcoital dysphoria. And like how orgasms can feel different, sexual experiences can be different. And post nut clarity is not necessarily uh, have to be a good feeling. You can, like you said, it can be regret, it can be shame, you can have sense of depression, sadness, disgust. All ranges of emotions are something that you can feel after you have sex. And this doesn't just happen in guys, this can happen in women as well. There was a study that showed that the most common symptoms in women were mood swings and sadness, whereas in men it was unhappiness and low energy. So, and it can also not happen besides sex. That 46.6% of men felt it after they masturbated. So yeah,
We've been
postcoital
there. I
dysphoria
think
is.
most men can relate. It's probably higher than 46.6% for masturbation. I
Hey,
mean, I
I'm
think
gonna,
that
I'm gonna, I'm gonna throw in just a, one of my favorite things I've ever read on Reddit is was this. They were saying like, yeah, when do you feel the lowest in your life? And it was some guy who basically said, yeah, whenever back in the days when the internet was a little slower and they were about to masturbate, and the reflective glare whenever there was on the loading screen, and all they could see was their own face with the hand on the.
that's pre-nut clarity, my
That's
friends.
pretty.
That's pre-nut dysphoria.
that's
But no, they have this, right? I've seen memes like this. It's like analogous. They're like, before watching porn, you see like a nice cheeseburger that like they put on the commercials, and it's like after coming, and you see like some half shitty thing that you like pulled out of the garbage burger. So
yeah,
this is something that's very relatable, right?
yeah.
I mean, it does seem that, not all post nut clarity is good. Can have clarity, like you said, of like, oh shit, maybe I didn't want to do this, or maybe shit, I shouldn't have done this. So like, or shit, maybe not with this person, or I still feel bad about it. And I think it is very interesting. And I think, just to, piggyback off of you, I think they did a study that showed that 41% of men reported having any experience, I think, of postcoital dysphoria, and about 20% reported experiencing it in previous month. So, this is something that a lot of people experience, a lot of men experience. And that leads to my next question, Kev. So, you already said that women experience postcoital dysphoria. So if they can experience that, do you think that women in general also have post nut clarity? Because we've talked about men, and anytime we talk about post nut clarity, we think about men and post nut clarity. So do you think women also have post nut clarity?
I mean, yeah, I would think so. It kind of makes sense. We all kind of have the same, well, maybe not the same things going in through our brain, but the same parts of the brain, the same kind of hormones. Um, and absolutely, I really do think that it's more of a kind of issue with social stigmas that, or that we don't talk so much about female sexual health. We have a lot of our colleagues who are doing great work in this space of trying to make it something that's much more easier to talk about. But we let's talk about the orgasm gap. 39% of women compared to 91% of men said that they have usually or always experienced orgasm in partner sex. And only 20 to 30% of women achieve orgasm with penetrative intercourse alone. Like there is that, again, that gap that we've talked about in the past. And I think that kind of helps, that kind of contributes to why we don't think of like, oh, post nut clarity happens in women.
Yeah, I think you're right. I think that, first off, if the dysphoria occurs in women, how could not the clarity
Right.
pleasure part, right? I think that's immediately what we can say. But I think your point is so important that, if women aren't orgasming as much as they should, they're never going to get post nut clarity. I mean, that's the bottom line, right? I mean, if the standard, like you said, is during sex ends when the man orgasms. So the female is not always achieving
Right.
orgasm. So if they're not achieving orgasm, maybe they only have regret because they didn't achieve orgasm, to be honest with you. But yeah, you can't achieve post nut clarity if you're not nutting. So I think it's a really great point. So I think, Kevin, we pretty much highlight post nut clarity here. Are we debunking this myth as true, not true? What do you think?
I'll say this: the while there may not be set evidence that's backing it, I would say it's compelling hypo, hypotheticals that it's there.
Yeah, I agree. I think that you're right. There is no strong data that it's there. There's no research that it's there, but there's also no research that it isn't there. But there is data showing that you can have shame and experiences like that, both in men and women. So why can't you experience the clarity of it? The physiology is there, just not the actual proof. So I think we're showing once again, we're two for two. Another sex myth is true, not debunked, factual.
Fact.
All right, let's move on to our last myth of the episode. All right, Kev. So to wrap up our last myth for sexual medicine that we're going to talk about today, we're going to talk about jelqing. And interesting enough, jelqing is one of those things that has always been around, but it's really gained popularity, unfortunately, as we'll go into over, I think, the last few years and with the rise of social media. So, Kevin, my question first is, what is jelqing and where did it come from?
So first off, I get why things have taken off. Look, there has been this sentiment that we've seen that people want to try to do things naturally to to get improvements in their
Yeah.
body, and I don't blame them. Like I want to myself as well, but there's a difference between potentially causing harm and just doing things because someone told you to do versus things that actually will benefit. So jelqing is one of these things that, again, like you said, has come up. It basically it originates itself in traditional Middle Eastern practices, and basically it's an exercise that involves pulling and massaging the penis with your fingers, or specially designed jelqing devices that are available out there. And the whole idea is that you're massaging your penile tissue and stretching the skin to create micro tears so that they look engorged when they heal. And the goal and the whole idea of this is that you're naturally finding a way to make your penis look longer or thicker. So that's basically joking. Now, Justin, we as sexual medicine docs, we use things such as penile traction devices and vacuum erection devices uh, to kind of do similar things. Can you elaborate a little bit more on those?
Yeah, so I think and I think just to take a step back here, the question of is jelqing effective? No, jelqing does not do
It's not.
anything.
It's not. I got to go.
Jelqing Jelqing does not improve your penis length. It cannot. There's no data supporting this at all. And we'll go into the risks of it. But to your question, because you're right, I think some people will say, well, listen, penile traction devices exist. And we know that there's good data on these devices to show that it can improve your penis length. It can restore your penis length. And for some people, it can improve your erections. But why do those work? And why are you telling me that jelqing, which is also a retraction of my penis, just with my hand often, not effective in the same way? Well, I think part of it is, with these, traction devices that we recommend, I'll highlight the RestoreX, for example. These are often used to restore previous penis lengths. There's good data for people who had prostatectomies who lost penis length. It restores their length. For people who have Peyronie's disease, curvature, or decreased length, it helps break down that scar and then help restore your length. A lot of it is the word restorative therapy, not lengthening. There is some data on lengthening as well. But the idea here is that these devices use gentle, and the key word here is controlled and progressive traction forces that are put on your penis, right? When you're joking, you're yanking that thing, man. You're just pulling that thing. You have no control. You're using your hand. You're whipping it around in all directions, different forces. It's dangerous. Like, it's truly dangerous. You're trying to literally almost rip your dick off in these manners for a lot of these people. Where it's different. When you use a penile traction device, it's stretched. You're wearing it for at least 20 minutes. It's controlled and it's safe. So, there is a huge difference there. Now, Kevin, you know, my question for you is, what are the risks of jelqing?
So, like you said, with jockeying, you're really manipulating, pulling your penis in various different ways. And some of those things that you were just talking about, such as traction devices to help treat patients with Peyronie's, which is, again, scar tissue that's formed on the penis to cause curvature, you can actually cause that yourself with joking. So you could be doing all these things to try to lengthen your penis. Next thing you know, you've created curvature with the scar tissue, and you find yourself right back in that in the traction device.
Yeah, I mean, you're literally potentially shrinking your penis the
Right.
way that with jelqing, and you can cause erectile dysfunction. I mean, I don't know, Kev. Have you had guys come to your office who have jelqed?
I have patients who come in. I will say sometimes I would say see some bruising, and they'd be like, "Hey, doc, is this normal?" That's like the most common thing that guys would come and be like, "Yeah, I've tried this thing that I saw on the internet, but it's kind of bruised on my penis." I'm like, "Yo, just stop. It's not a good thing."
Yeah,
Justin,
I've
you
seen
see
it.
it?
Yeah, man. I've seen a couple patients come in, they're bruised up. Thankfully, no one's fractured their penis. Theoretically, could you fracture your penis and then cause true, really bad erectile dysfunction? Yeah. I mean, I haven't seen it. But yeah, you can. Micro traumas to your penis is what causes Peyronie's disease. So by joking, you're really putting yourself at risk for that. You're putting yourself at risk for, you know, penile injury, penile fracture. So, it's something that we really don't recommend in any capacity. Now, Kevin, what the hell is going online with social media? I mean, you alluded to it before, but I'm seeing all these young dudes on TikTok, Instagram, just saying like jelqing is the way to be. Like, what do you think's going on there?
I mean, hey, some of that stuff is compelling. The way they present it, I'm like, I'm gonna give this a try because yeah, I'm gonna get another 1 to 2 inches.
Right, right. That's what they say. They literally say that.
Look, guys are at the end of the day sensitive about their man part, right? We are.
Yeah.
That's why we, yeah, man, we sound like broken. We would talk about this over and over again, but that's why we do the show is to kind of destigmatize a lot of things, talking about sensitive stuff. And again, the penis is really a symbol of masculinity, and it's thought of that it symbolizes attributes such as largeness, strength, endurance, ability, courage, intelligence, knowledge, and everything good, right? It's and but that's really a symbol of that. So I think guys, I guess online want to kind of self perpetuate. I don't know, Justin.
Yeah, I think that, like you're saying, like, people just or not people, men value their penis. They value their penis size. And sometimes they always think bigger is better, right? I feel like almost everyone thinks this
Right.
idea bigger is better. And if I can find a way to improve my penis size, I have better value to some degree. I have no idea to who, to themselves, to their confidence. And so I think going online, finding cheap, easy ways to do something is what guys do, because they're not going to come to us to talk about it. Why? Because they're embarrassed, right? No one wants to come in. So they go online and they look for quick, easy ways. But I think it's crazy when you go on these videos. How old is the average person that's telling you about joking online, Kevin? I mean, it's got to be 18 to 22 years old. I'm not kidding, right? I mean, so it's so interesting because in a space like being on social media, I feel like everyone's prone to just listen to whoever's
Right.
on the screen. But if you take a step back and you're like, I'm gonna yank my dick because some 21-year-old guy says this is what doctors don't want you to know. This is the way to get your dick bigger. It worked for me, and just yank that thing. It's crazy to me that people are listening to this instead of talking to their doctors.
Well, I want to play a little devil's advocate. I actually don't
Please.
think it's so crazy that people are listening to this. I'm reminded of back in college. I'm going to leave my friend's name. Well, we won't name him. But again, 18, 22-year-olds were hanging out, and he's like, hey, didn't you guys do exercises for your penis? I'm like, what are you talking about? He's like, I get my penis erect. I take a hand towel. I put it on my erect penis. And then I just, contract a couple times to, go up and down to give it more
Like a
strength and to
cock
give
pull up.
kind of like a cock pull up. Yeah. And I'm like, what? But but when I was in college, we didn't have social media. Now, probably like, hey, let's put that online. And a ton of people will listen to it. It's just
Yeah, I mean, but I also think that it's like 40-year-old men listening to 18-year-old
it's
dudes.
true.
Not
That's true.
it's not just like another 18-year-old
That's
dude.
true.
You know what I mean? Like, I think you have older people listening to this stuff. And once again, red flags for things on social media that are bullshit is this is what your doctor doesn't want you to know. This worked for me. I don't know. Just these are the common things. And like, always ask, who the hell am I listening to? Why am I
Right.
listening to them? What the hell is going on? And then the other question I guess I have is like, people always are like, well, joking should be real. Like you said, Kevin, it's an ancient thing that's been going on for thousands of years. So people have definitely, been doing it. So it must work. Trust me, if we knew how to make a dick bigger, Kevin and I would be the richest people on earth. I mean,
Well, I mean, there are ways to get
there
bigger.
are ways. Go ahead. Tell us how we can make our dicks bigger, but they're not free and they're not cheap and they're not easy to do.
Right. Your point exactly. There's been no proven natural way
Right.
of like lengthening your penis. There's just no data on any of this, and you see the harms with it. We see the harms of it. Sorry, we see the harms of
Yeah.
it when you come in. Now, if cosmetically you want to increase girth, right? If they, let's say that to make your penis thicker, there are dermal fillers that you can put out there. As long as it's done by someone that's well trained, it should be a rather safe procedure that can achieve the gains that you're looking for, and you will get to your goal, and you won't harm your penis. Versus this method, you are potentially harming yourself and just listening to a lot of bullshit.
Yeah, and we did list other ways to increase your penis length. Girth is great enhancement. There are these dermal fillers that are safe. They're reversible. We talked about the penile traction devices. Those are safe, things, but they take a lot of time and they cost money, right? The penile, I think the data shows for those to work, I think is at least 4 months. You got to wear it 20 minutes a day at minimum. So it's not like, one-off things are just going to make your penis bigger. It just doesn't make sense. So before you're, and I find it funny just because like we've seen a lot of people do some wild shit to their penises, right? And I think Jelqing is not that wild. It's really not. Like you said before, it kind of makes sense if you try to think about it in a way like, yeah, if I just yank this thing enough, it's probably just going to get longer. But, guys are so sensitive about their penises, but in their bedrooms and the privacies of their homes, I find it so interesting how willing they are to try to sometimes do some riskier or more, out there things to do for their penis health or their penis length where they're potentially damaging themselves. So I think the real lesson here is, if you're trying to do anything to your penis, if you're interested in increasing your penis length, go talk to your local urologist, man. There's ways in which we can do it. They may not be ways that you want to hear or you can afford, or it may not get you I'm not going to make you 5 inches bigger, but, at least listen to them before you're doing anything that you could permanently damage your penis.
I think that's well said.
So, Kevin, Jelqing, is it good? Not good? Does it work? Give us the final myth.
Well, the final verdict on this is that this shit does not work.
All right, guys. This was a really fun
Justin
episode.
and I are not keeping the secret like just to us. We're like, hey guys, this doesn't work. Only Justin and I.
We've been Jelqing for 20 years. Our penises are down to our ankles. That's why we always record from the waist up. But yeah, no, you're right. It's bullshit. Don't do it. Don't hurt yourself. And I think that marks the end of this episode. We've actually proven in the end 2 myths to be true. Blue balls is true.
Yep.
We think, although inconclusive, we do think post-nut clarity is real. And then finally, we have disproved the value of Jelqing, so don't do that one. Kind of cool spectrum, a little bit of everything there for all of these. And thanks for everyone for listening. If you have any other myths, whether it's fertility, sexual health, men's health, erections, let us know. Feel free to email us at themanuppod or themanuppod@gmail.com. You can message us on Instagram, and you can always comment on our YouTube as well. And so if you're watching there, feel free to comment and ask some questions as well. Subscribe, download all you'd like. Really watch the YouTube. We really want to subscribe and promote that at this time. But as always, thanks for listening. Until next time.